My father being a firefighter and out helping the community inspired me to go into a field that was similar, and I had a strong liking for science and anatomy and also for people. So that combination led me into going into medical school, which then ultimately progressed into orthopedics and then ultimately hand upper extremity surgery. Different types of procedures that we certainly do as hand and upper extremity surgeons, again, deal with anything that's either traumatically involved, such as fractures of the hand, the wrist, or the arm. Certainly conditions that are chronic, such as arthritic type conditions of the hand, wrist, and elbow and shoulder as well. We also deal with nerve compression syndromes in the arm and hand and wrist. And with all those conditions, we would start off certainly with conservative management, trying to treat those as best as possible. If people fail conservative management, then only then do you move on to potentially surgical options for the patient. Very important in my practice to make that patient feel comfortable with not only their diagnosis, but their interactions with me as their treating physician. I realize that patients are taking time off of work, coming in and to see me as their treating physician, and they are wanting to see someone that actually cares about them as a person, is going to spend quality time with them, educating them on what the condition actually, the diagnosis is, and what the treatment regimen will be. So I take that very personal and take extra time to make sure the patients are comfortable with the plan before they would leave. Every surgeon here has a subspecialty training in a particular area that we focus in. So if a patient comes to myself or to one of my partners, and we have another physician in the office that is more specialized in that particular area, that patient would then be referred within the practice to the more appropriate physician. I think that's a strength of our practice. We take pride in ensuring good outcomes for patients. We also take pride in the fact that the patients are most appropriately directed to the best surgeon or best physician for that particular condition. I make myself very accessible to my patients. My patients, as they leave, I often give them my card with a direct line to our practice that bypasses our phone system. So if a patient has a question, problem, or issue, they can call the practice, get in touch with my assistant, who will give me the information on what the patient's questions may be. If they cannot answer it, then I certainly also will call that patient. If the patient wants to speak with me personally about any questions they may have concerning their condition or treatment, I am more than happy to call them personally back and discuss that with them. In terms of patients being comfortable with coming to see me for their hand or wrist or upper extremity condition, I think that probably the most valuable insight is my patient referral base. Most of the patients that are coming to see me are oftentimes referred by other patients I've previously treated or family members of the patients I've treated. In addition, referring physicians in the community oftentimes will refer the patients over and over again back to me for conditions, because they get a lot of good feedback from those patients concerning their treatment and care rendered here at Town Center Orthopedics. We have 3 hand therapists that are here on site at Town Center Orthopedics. 2 of them currently working in the Reston location and 1 in Centerville. They work very closely with me to ensure good outcomes. And this is for patients that are non-surgical as well as patients that have had surgery. We collaborate daily concerning patients' progress, and they will oftentimes give me feedback or modify treatment as necessary. And that direct access to me and direct access to them is, I think, invaluable in terms of ensuring great outcomes for patients. Most patients that come in here with orthopedic hand and wrist problems and upper extremity issues are treated in a conservative fashion, and most, I'd say over 90%, get better. It's only the patients that have failed conservative measures and that actually opt for surgery that end up requiring surgical intervention. In those patients that do require surgical intervention, we do everything possible to do the least invasive procedure that we can to minimize any type of scarring and optimize outcome. Patients oftentimes ask about what will the incision look like, and it's very important to me what that incision looks like, and I oftentimes all the time will close that incision as cosmetically as possible to obviously have a good look on the outside as well as a good functional outcome. So that's important to me as well.